Welcome. You are part of the PleasePrEPMe community. PleasePrEPMe.org is a website that provides PEP and PrEP navigation services in English and in Spanish to Californians. We link consumers who are interested in PEP or PrEP to local services and support them directly with accessing PrEP. Some background on PrEP in case you were wondering. PrEP, or pre-exposure prophylaxis, is an effective strategy to prevent HIV. You may also hear it be called Truvada, which is the brand name for PrEP. It's one pill once a day. PrEP is safe, and when taken as prescribed, it's more than 90% effective in preventing HIV. PrEP works for men, it works for women. PrEP works for people of trans experience and people who are gender nonconforming. PrEP works for folks who identify as gay, straight, queer. It works for youth. Basically, PrEP works for all people. PEP, or post-exposure prophylaxis, is an emergency option for someone who may have been exposed to HIV. It involves starting a 28-day course of medication within 72 hours of that exposure. As you can probably imagine, both PEP and PrEP are important tools in achieving the end of the HIV/AIDS epidemic. This is where our work at PleasePrEPMe.org and your work at your clinic or medical practice comes in. At PleasePrEPMe.org, we list PrEP providers across California. We also work closely with people via our chat service to find them PrEP services that meet their needs. Your clinic is listed as one of those providers. As the first point of contact for many potential PrEP patients, you play a critical role in helping them access PrEP services. Patients might find you by just simply searching our directory or be referred to you by our PrEP navigator through the chat feature on our website. Others may be referred to you by a different provider. We encourage you to reach out to your supervisor or manager and create an easy and manageable plan for when patients come in for PrEP. You can also always ask us questions via our chat feature. When someone comes into your clinic looking for PrEP services, where can you direct them? Is there a point person for PrEP at your clinic? Are you able to make them an appointment with a provider who can talk to them about PrEP? Is there someone who can help them with insurance or payment questions, or is there somewhere you can refer them for questions around coverage in general? Everyone being on the same page can really help the patient move along in the process and keep clinic flow going. With advances in HIV treatment and prevention, we may actually live to see the first AIDS-free generation. To do this, however, we're going to need all hands on deck. We can reduce the number of HIV infections if people know about and have access to interventions like PrEP. Let us assist those who are seeking PrEP or even just curious about their various sexual health options. PrEP has truly revolutionized HIV prevention and overall sexual health for thousands of people across the country and increasingly around the globe. However, there are still huge disparities in access, with many of those who most stand to benefit from PrEP still facing difficult hurdles in getting it, or even not knowing about its existence. When we send patients to any of the 300 clinics statewide listed in our database, we know that you will carry our work forward.